Good afternoon. My name is Taisha Richardson, and I am here to talk about a problem that affects millions of people. The influence of socioeconomic factors on eating and its effect on one's health. It is an urgent issue that requires our focus and joint reaction. The socioeconomic influence of our relationship with food, such as income, education, and resource access, are very important. They influence how we may obtain, buy, and eat nourishing meals. Unfortunately, these elements frequently result in a clear separation between people who have access to food security and those who do not. According to the American Progress, significant gender, racial, ethnic gaps still exist. Given that these discrepancies have persisted for years, it is obvious that governments must make continuous, targeted investments to address injustices. Income is one of the major variables impacted by the socioeconomic conditions. The types of meals we can afford depend on our financial status. The rising cost of fresh and wholesome foods can be a significant financial strain for many low-income households. As a result, people are compelled to rely on less expensive, processed meals that are deficient in the nutrients needed for healthy diets. Particularly among vulnerable people like children and the elderly, this income imbalance feeds a cycle of hunger and poor health. The National Institution of Health states that food insecurity and the lack of access of affordable, nutritious food are associated with the increased risk of multiple chronic health conditions, such as diabetes, obesity, heart disease, mental health disorders, and other chronic diseases. Additionally, socioeconomic considerations play a role in the development of food deserts, which are regions with insufficient access to supermarkets and fresh foods vendors. In low-income areas, where residents must drive great distance to get affordable, wholesome food options, these food deserts are most common. In addition to making it difficult for people to make healthy decisions, this lack of accessibility worsens the difference in health outcomes between various socioeconomic groups. Having healthy food available and reasonably priced in food retail and food service settings allow people to make healthier food choices, according to the CDC. People may settle for foods that are greater in calories and poorer in nutritional value and content when healthier food alternatives are not available. Education and nutrition awareness are important factors in determining our eating patterns. Unfortunately, socioeconomic differences frequently result in a lack of knowledge and awareness of appropriate eating habits. People from unprivileged origins could rely on cheap, widely available, harmful processed meals if they don't know how to eat properly. This lack of understanding keeps communities trapped in a cycle of bad health, hinders them from escaping food insecurities. According to a recent report, the mayor of New York City has launched a new initiative to teach the city's younger children about the advantages of eating healthier. According to this article, food education is important in establishing healthy habits for a lifetime and assisting students in becoming a better learner. We have the ability to eliminate these socioeconomic inequalities and establish a more just food system. We can raise people and family out of poverty and give them access to better food options by implementing policies that support income inequalities and economic possibilities. Additionally, Investing in educational initiatives that in part acknowledge about nutrition and culinary techniques might enable communities to take control of their diets and end the cycle of unhealthy eating practices. The creation of regional food networks that offers community access to affordable, wholesome foods must also give top priority. We can lessen our reliance on pricey imports and build a resilient and inclusive food supply chain by assisting local farmers and encouraging sustainable agriculture. According to the New York State.gov, the New York State Farm to School program was established to link schools with nearby farms and food producers in an effort to support local agricultures and to enhance students' health and raise knowledge of regional food systems. In addition to assisting New York State farmers, this initiative educates children about farming in the hope that the knowledge will spread to families and ultimately communities. In conclusion, it is evident that the socioeconomic conditions have an impact on food. Food insecurities and health injustices become more prevalent as a result of discrepancies in food access, pricing, and consumption habits. However, let's work together to make sure that everyone has access to the nutritional food they need. Let's work towards a more just and fair society by addressing income inequalities, enhancing nutrition education and understanding, and assisting local food systems for a healthier and productive life, regardless of their socioeconomic status. Again, my name is Taisha Richardson, and this is my entry. Thank you.